Hello, my name is Gil Penalosa, and this is Cities for Everyone, the webinar. Every other Tuesday, I invite fascinating people from around the world to share experiences and knowledge that will help us create affordable, equitable, and sustainable cities. I was born in Bogota, Colombia, where as commissioner, I led the design and construction of over 200 parks and took a small program called Ciclovia, Open Streets, and increased it to over 120 kilometers, 75 miles of car-free streets every Sunday and holiday, where more than 1 million people walk, bike, run, shop, enjoying the presence of each other. 17 years ago, I created 880 Cities, a non-profit organization based in Toronto, Canada, where I live. Last year, I ran for mayor and came second with 100,000 votes. My aim was to change the conversation in creating a Toronto for everyone. I've been fortunate to have worked in over 350 cities in all continents, sharing and learning. Based on all experiences, I developed master classes and keynotes customized to each city. But Cities for Everyone, the webinar, is a way of giving back. It's always free and hopefully always interesting. Please invite others to join us every other Tuesday, anyone who cares about cities and people, equity and sustainability, about all living older, healthier, and happier. Hello, good morning, good evening, wherever you are. My name is Gil Penalosa, and I am the founder of 880 Cities and also Cities for Everyone. And I created this webinar every other Tuesday because I want to give back. I've worked in over 350 different cities, and I think that it's important to help develop passionate advocates in order to develop cities that are more equitable and more sustainable. Today, we have a fascinating topic. It's climate resilience for an aging nation. Climate resilience is something that affects everybody, all over the world, big cities, small cities, young people, old people. But we're going to focus on the older adults and aging because we're living longer everywhere. We have doubled the life expectancy almost in every country in the last 150 years. But nevertheless, when we have any kind of climate crisis, the older adults suffer more, disproportionately more than any other segment of the population. And Danielle Arrigoni is the author of a book that is coming out in October with the same title, Climate Resilience for an Aging Nation. Danielle, welcome. We are so eager. Currently, we have fires in Canada, wildfires from coast to coast to coast. And I think all over the world, we have seen the impact, and also on older adults. So please, welcome. Tell us about the topic. And afterwards, we'll have a dialogue, including the questions from many of the participants from all over the world. Danielle, welcome. Thank you very much.
Thank you. Thank you so much, Gil. It's really a pleasure to be here. And really, thank you to everyone from joining all around the world. I love seeing all the names and places pop up. I hope that my audio is okay. If it's not, Gil, please wave me down. But really, I want to thank you for taking the time to focus on this topic. I share Gil's concern that really thinking about how climate change is impacting older adults is of principal importance. It really is essential that we both understand why and how climate change is differently impacting older adults, in part because of the tremendous growth among older adults. Let's see, hopefully my slides will advance here. There we go. So first, I want to start by telling you a little bit about who I am. My name is Danielle Arrigoni. My position is Managing Director of Policy and Solutions at National Housing Trust. We are a nonprofit organization here in the U.S. with about 35 years experience working on affordable housing preservation. We work at the intersection of climate resilience, affordable housing, and equity. And while I spend my days thinking about how to make affordable housing more resilient, the talk today really is about broadening the lens to look holistically at the climate risks that we all face. We're here today to focus on the particular intersection of age and climate. For most people, there's very little doubt anymore that climate change is real and increasingly impacting our daily lives. In the US, in Canada, and across the world, people now endure summers that are characterized by code red air quality days and winters by either too much or too little snowpack. Extreme heat and cold are becoming more common throughout the US and across the world. Hurricanes are increasingly frequent, intense, and deadly. In the US, one way that we track the rising incidence of disasters is to count those that result in at least $1 billion of damage. That's billion with a B. According to the US government, the number of billion-dollar disasters has increased each year. About a decade ago, the average was 8 per year. Last year, there were 18. And this year, as of July, we were already at 50, and hurricane season has yet to begin. These disasters include the full array of wildfires, storms, flooding, hurricanes, cold waves, and droughts, and reach nearly all corners of our country. And as we saw recently in Hawaii, they lead to the loss of life, the devastation of homes and communities that will take years to recover from. And this trend intersects with and compounds another one that is less talked about and maybe less apparent, but which will nevertheless have a tremendous impact on our communities too. We are in the US, as a country and as a world, as Gil said, becoming older. People over 65 are the fastest growing demographic, a change attributable to the fact that in the last 100 years, the rate of growth among older adults was significantly faster than the overall population. 100 years ago, just 1 in 20 people was over 65. Today in the US, roughly 1 in 5 is. Moreover, by 2034, there will be more people over 65 than under 18 in the US for the first time ever. In the US, our older adults are increasingly diverse, with faster growth rates among non-white older adults than white older adults. And this growing share of older adults is not unique to the US. In Japan, people over 65 already account for nearly 30% of the population, a figure that will grow to 40% by 2060. Together, these trends call for a renewed focus on what it means to be climate resilient in the face of a growing share of older adults in our communities. Unfortunately, it's easy to conclude that we are not at all prepared for this future by looking at how older adults fared in past disasters in the US. I began to notice this trend when working at AARP, which is the largest advocacy organization in the US, focused on the needs of older adults, where my job was to advance strategies that would make communities more livable for older adults. We knew that by making places more well-suited to aging in place, we were also creating ones that work better for people of all ages and all abilities. But once I began to key into the realities of how communities did or did not safeguard older adults in times of disaster, it became clear that we were failing to create places where older adults could safely age in place. With each passing event, there was more and more evidence that the ways communities respond to disasters was not working well for older adults in their times of most acute need. Because time and time again, older adults were hugely overrepresented among the deaths that resulted. This pattern of disproportionate impact became painfully evident in the news stories about each event. In 2008, this tragic result was reported on the heels of Hurricane Katrina, where well over 2/3 of the near 1,000 people who died were over 60 and half were over 75. 10 years later, similar results were evident in Hurricanes Florence and Maria. Acknowledge that we have guests here from Puerto Rico. The latter case being a situation where nearly all of the deaths in Puerto Rico caused by Hurricane Maria were older adults. Just 3 years ago, the wildfires that impacted California and Oregon took a similar toll on older adults. Whoops. And in 22, Hurricane Ian made landfall in Florida and other parts of the US, Southeast. Once again, the majority of people who died were adults. And just this month, early reports about who died in the Hawaii wildfires suggest that many, likely the majority of the deaths, will be older adults. Surely lessons could have been learned from each of these tragedies, and clearly the news had informed people about the disproportionate results. But despite these facts, there's been virtually no progress in reducing the impact on older adults in the last 2 decades. We simply have not made it a priority to reverse this trend. Consistently, older adults, despite being just 20% of the population in the US on average, represented half, two-thirds, or even 100% of people who died in disasters as a result of our inability to effectively mitigate their risk. No matter how many events occur each year or what type of event it is, older adults bear the brunt and pay the price. All the evidence points to the fact that as a country, and perhaps as a world, we haven't yet honestly assessed risk for older adults, nor have we prioritized their safety. We have not taken the steps needed to protect older adults in the face of climate change. We could spend a whole webinar talking about why this is. I think it's a tragic blend of ageism, ableism, and denialism about how climate change is likely to truly affect our lives. But I think the question that we should more urgently ask is, what can we do about it? For me, I felt that I could make a contribution by diving deep into the topic, ultimately sharing my perspective in the form of a book, Climate Resilience for an Aging Nation. Drawing on lessons learned throughout my career and even more learned during my year of research, I finally landed on 3 big takeaways. First, we have to be clear-eyed in our understanding about how climate change is impacting older adults and accept that in many cases, it impacts them more greatly. This can be hard, however, because it's rooted in a poor understanding to begin with of who older adults are. Unlike children, there is no standard definition. Older adults are generally understood as people over 60 or 65, but they are a varied group across ages and abilities. And in the US, they are growing more racially, ethnically, and linguistically diverse every year. So understanding how climate change impacts older adults is essential foundational work. Second, we need to recognize that individual and even institutional preparedness is not enough. One conclusion that I reached from my research is that these tragic lives lost aren't often the result of a failure of individuals to prepare. More often, they are the result of unrealistic expectations about what it means to be prepared for someone who lives on fixed income, or who cares for a homebound family member, or who can't drive. They are also the result of systems-wide failures that impact the whole community, but especially older adults, and therefore must be dealt with at the community scale. Third, for these and other reasons are why we need to lean into community-wide resilience. That means that all sectors and all disciplines have a role to play. Emergency managers, housing advocates and transportation planners, healthcare professionals, utilities, and many more. This is no longer a job for any one sector or profession. It is a job for all of us. Furthermore, I believe it is the job for all of us. After all, we all have older adults in our lives whom we love. And we all presumably hope to live in a community ourselves where we will be safe and secure in the face of a changing climate. Working towards solutions that build community resilience means that we are creating systems through policy change, programs, and intentional outreach so that not only older adults are better protected, but so too are people of all ages and abilities. So let's begin by seeking to understand how climate change impacts older adults. While I was motivated to learn more about the topic because of the tragic death rates and disasters, I found evidence and observed that climate change is impacting older adults just as much, if not more, through everyday changes in the conditions in which we all live. First, let's discuss disasters. I've already covered at length how older adults are disproportionately represented among those who die in climate-fueled disasters. But even those who do not die in disasters suffer. Older adults take a financial hit when their homes are damaged or destroyed as a result of climate change. For those who own their home and who have most or all of their retirement savings tied up in their home equity, disasters can be devastating. It's hard for anyone to rebound, but particularly difficult for older adults due to their limited access to capital, little time to rebuild savings, and long timelines for federal relief in the US. Moreover, people who are struggling with cognitive decline or who aren't computer literate may find the administrative burden of accessing disaster relief to be simply too hard or too complex. Disasters also impact the health of older adults. When roads are closed, power goes down, or transportation is interrupted, people in need of regular medical care are unable to access it. When disasters damage a home in ways that create further health risk, like when flooding damage leads to black mold, the impacts on health have a far longer timeline. And when all of those effects are combined with the trauma of experiencing climate-fueled disasters, it's no surprise that research shows that they lead to worse health outcomes for older adults. Even for those who safely evacuate, either temporarily or permanently, health effects arise. The disruption of routine, lack of access to medical care or caregiving, and the trauma of the move can accelerate mental and physical decline. In this way, climate change becomes a very real threat to being able to successfully age independently in place. In my research, I learned of one man who had been evacuated from New Orleans in the southeastern U.S. The person was older, experiencing dementia, but was faring okay living on his own in his community because he knew how to navigate the bus system and where to get services. But when he was displaced to Houston, Texas, an entirely new context, lacking the public transportation he relied upon, his physical and mental decline accelerated and ultimately led to his placement in a nursing home. We're also living in new conditions that continue to change, even if they don't quite reach disaster levels on a daily basis. These too have a disproportionate effect on older adults. Our new normal is unfolding every day. We just finished, or nearly will finish, the hottest summer on record on Earth so far, which of course impacts everyone, but not everyone equally. I believe that climate change is wreaking havoc on older adults in a more insidious and complex way. Several of these new normal conditions intersect with pre-existing health conditions that are more prevalent among older adults and increase their risk. Those include extreme heat, extreme cold, prolonged rainfall, and sea level rise that leads to flooding, and wildfires that lead to smoke. Periods of prolonged heat in particular are deadly for older adults. In fact, extreme heat is now the leading cause of weather-related deaths in the U.S., killing more than all other weather-related deaths combined. Heat-related illnesses lead to 12,000 deaths each year, and of those, 80% are people over 60. We saw this in stark relief in the Pacific Northwest heat waves of 2021, where 1,000 people died. In the most impacted county, the average age was 67. That's because older bodies don't process excess heat the same way as younger bodies. Fatigue and weakness from heat exhaustion can be missed because they mimic other conditions, thereby going untreated. Wildfires and flooding also have an impact. Smoke from fires and black mold found in homes that have been flooded can exacerbate respiratory challenges. Dust from drought and fires can increase the risk of heart attack, especially for those who are overweight or diabetic. And as extreme temperatures strain our electric grid to cool and warm homes, it means that outages are becoming more common and even routine. While outages are an inconvenience for everyone, they are a true hazard for older adults who rely on in-home medical equipment, such as oxygen machines or lifts. When they last for several days, weeks, or even months, as has been the case in Texas, Louisiana, and Puerto Rico in recent years, those risks multiply. Residents of upper floor apartments in multifamily buildings without backup power and who can't manage the stairs become effectively trapped until the power comes back on. And the strain on our utilities doesn't just impact older adults' health and safety, it also takes a toll financially. As energy prices rise, so too does the challenge for low-income older adults to afford the cost of keeping their home cool or warm. Already, low-income households struggle to afford utilities. AARP reports that nearly 1 in 5 went without basic necessities for at least 1 month to pay an energy bill. On top of rising utility costs, the cost of insurance has grown, both of which add to the challenge already faced by many older adults to simply afford their rent or mortgage. Flood and wildfire insurance premiums are increasing as we develop more data-informed projections about risk. The cost of homeowners insurance, when it can be accessed at all, remains one of the most volatile sources of housing price increases. In some states, like California and Florida, insurers are no longer writing new homeowners insurance policies at all. And it doesn't just impact homeowners. Landlords pass along insurance premiums to renters in the form of higher rents. And builders, even our affordable housing peers, increasingly cite the cost of insurance as part of the reason why they and we can't develop more affordable housing in areas of greatest risk to climate change. These compound existing challenges. Already more than 1/3 of older adults and an even bigger share of low-income older adults and renters are housing cost burdened, paying more than 30% of their income for housing. When combined with the rising cost of utilities and insurance, these new climate-fueled conditions have a direct effect on the financial well-being of older adults. Now that we've unpacked how and why climate change is differently impacting older adults, let's explore why we cannot rely solely upon individual and even institutional preparedness as the solution. To be sure, both individual and institutional preparedness have their place. Each person bears some personal responsibility to plan for a future with greater risks. And institutions that care for older adults have a moral and often legal responsibility to protect their residents in times of crisis. But the reality is that there are limits to what can be reasonably expected in terms of being prepared for disaster. There are limits to what someone can do to stockpile sufficient food and prescriptions to weather a crisis, especially when they already struggle to make daily ends meet. That's certainly the case for the 15% of Americans over 65 who live at or below the poverty line. For people who live with cognitive decline, dementia, or Alzheimer's, as is the case for 1 in 9 people in the US over 65, there may be very real limitations to their ability to assess risk and to take the needed steps to plan for it. And certainly, preparedness is far more complex for people who are caregivers for a spouse, adult child, or older parent, and forced to weigh both individual and collective risks. Many of the stories of older adults who die in disasters tell of people who took some steps to prepare, but were ultimately overwhelmed by the conditions that they were confronted with and unable to get the help they needed because the systems were strained. There is also a rule for institutional preparedness. One of the somewhat positive legacies of past disasters is a 2016 federal policy here in the US called the Emergency Preparedness Rule that requires that any institution funded by Medicare or Medicaid prepare for disasters. This is somewhat good news for the 2% of older adults who live in congregate facilities like nursing homes or assisted living, but it too has its limitations. First, the vast majority, roughly 98% of older adults, live in the community. Many live with spouses, but nearly 30% live alone. Of course, some older adults live with and are cared for by family, but increasingly older adults in the US are childless. Whereas 11% of people over 65 have no kids, 20% of the younger older adults, ages 55 to 64, do not. Second, efforts to roll back the requirements of the Emergency Preparedness Rule has led to a patchwork of state enforcement. As a result, some states in the US take a more stringent approach to enforcing the policy, while others take a more hands-off approach. This can have deadly consequences. In Louisiana, following Hurricane Ida in 2021, 15 people died when they were evacuated from their nursing home to a warehouse in compliance with a plan that met the letter of the law, but nevertheless failed to protect older adults. For all of these reasons and more, better planning at the community scale has to be part of the equation. If we are to reduce the impacts of climate change on older adults and account for the limitations of individual and institutional preparedness, we must work, all of us, to build community resilience. That means thinking differently about what constitutes resilience and who's involved. I'm a land use planner by profession, so when I think about what sort of strategies constitute resilience, my mind goes first to public systems, policies, and infrastructure improvements. Resilience at the community scale means policies and investments that do things like build more seawalls and levees to protect communities, use green infrastructure to better manage flooding, and support a more resilient grid that can withstand extreme conditions and keep the power.
Danielle, please, could you keep your mic closer to your mouth?
Yes, I will do that. Thank you.
Sorry.
That's okay. But it also includes policies that foster more resilient housing construction, especially in age-targeted housing, through stronger building codes and so on. It would include policies that encourage smaller, denser housing that reduces utility consumption, but also cultivates a social network that can help in times of disaster. Resilience would mean building a transportation network that includes public transit and fosters biking and walking to provide safe, affordable, and reliable options for the roughly 1 in 5 people over 65 who don't drive in the US. That both creates redundancy in how people can access services and how help can be delivered, but also helps to mitigate carbon emissions. And it would also include multiple modes of communicating about disasters, keeping in mind the significant share of older adults who aren't internet savvy or who live with disabilities or who speak a language other than English. These investments address the needs of older adults, but the benefits accrue to everyone. But the job is not one for planners alone. There's a role for many more sectors in driving towards that climate resilient future. Who needs to be involved to achieve community scale resilience? All of us. Reducing risk truly is a job for all of us, since every sector wields levers and includes decision points that can be made to better reduce risk for older adults. For example, utilities can implement payment systems that lower the seasonal cost spikes that may cause older adults to go without cooling or heating. They can encourage greater energy efficiency in homes and the use of renewable energy and battery storage. They can do a better job at communicating planned power outages. They can suspend service cutoffs for non-payment during times of extreme weather. Healthcare professionals can proactively address the issue of climate change in the course of medical care so that older adults and their caregivers better understand the risks of longer, hotter seasons or poor air quality days, especially as they relate to underlying medical conditions. Home health aides, that quiet backbone of our U.S. care system, can be trained to help their clients better prepare for climate-related risks and identify interventions in their home that can make them safer, like backup power or air purifiers. Healthcare facilities can also more readily use mobile clinics in their practice so that patients who need regular care can get it, even when transportation systems are disrupted. And emergency managers and climate resilience have an important role to play in explicitly incorporating aging in their planning, not just for older adults who live in facilities, but also for the vast majority who live in the community, often alone. They can plug into existing age-friendly planning efforts at the local or regional scale. Emergency managers can serve as both a resource and as leaders to advocate for better housing, transportation, and infrastructure solutions that are grounded in the realities of climate-related risks. When these and other disciplines center their work around the needs of older adults and embrace solutions that reduce climate-related risks for them, we create safer and more resilient places for all. So let me close by reminding everyone that it's really centering climate resilience and the needs of older adults. When we do that, we solve for other needs. We solve for the needs of people on limited incomes or who can't drive or who live with disabilities. We also serve the needs of our future selves by creating systems community-wide that better account for our changing abilities, needs, and risks as we age. And let me close by returning to where I began, which is thanking you for taking the time to learn about this topic. For it's only by focusing on the needs of older adults and then working together across disciplines to reduce their risks that we can begin to achieve a more climate resilient future for all of us. If you're interested to learn more, I'd encourage you to pre-order my book, which comes out in October, available through Island Press Publishing. And again, thank you.
Danielle, this was fantastic. I think that it was so appropriate. Also, the message that if we create cities that are more resilient to climate change for older adults, they're going to be better for everybody. If we improve the communications, if we improve the infrastructure, if we improve the way to deal with it, it's going to be for people of all ages and all abilities. And it's very clear, you show multiple examples from many areas on how older adults are being impacted. Not only the huge crisis, but almost on the day-to-day, on the living, and how the communities can strengthen. And how also older adults, everybody should care about this because it's our grandparents, our parents, our brothers, our sisters, our own selves, and as well as the young people. It will be themselves if they are lucky to become older adults. So this is a very important topic, very timely. I wish you all the best with the book on climate resilience for an aging nation, which is equally valid for any nation anywhere. Thank you, Danielle, for having accepted the invitation. A wonderful presentation. And thanks everybody who joined us today. And we'll see you 2 weeks from today. Take care.